Imagine feeling trapped in your own skin, constantly battling a world that doesn't understand you. The weight of gender-based trauma can be overwhelming, leaving scars that run deep. But what if there was a way to heal, to reclaim your identity, and find safety in a world that often feels hostile? Today, we're diving into the transformative power of gender trauma-informed therapy. Welcome to the Brain Talk Sessions YouTube channel. Your journey to a healthier mind starts here, where we share psychology explained for everyday life. Gender-based trauma is a critical issue that's often overlooked in mainstream psychology. It can stem from various sources: discrimination, rejection by family, bullying, or systemic oppression. This type of trauma doesn't just affect mental health, it shapes identity development, relationships, and even daily safety. By recognizing its importance, we validate the experiences of countless individuals struggling to find their place in the world. Traditional therapy models sometimes fall short when it comes to addressing gender-related experiences. That's where inclusive therapy comes in. It recognizes identity as central to well-being and provides specific methods to heal trauma without invalidating who you are at your core. But what exactly counts as gender trauma? It's not just physical violence. Verbal harassment, sexual assault, rejection of identity, being misgendered, institutional discrimination, or forced conformity to gender norms all fall under this umbrella. Understanding this diversity is crucial because trauma isn't always visible, it can be psychological and systemic too. The impacts of gender trauma can be both immediate and long-lasting. In the short term, it often leads to anxiety, depression, PTSD, or dissociation. Over time, it can erode self-esteem, disrupt relationships, and reduce trust in healthcare systems. These consequences highlight why specialized support is so vital. So, how do we approach healing? Trauma-informed care is built on core principles: safety, trust, choice, collaboration, and empowerment. In practice, this might mean ensuring therapy spaces are confidential and affirming, or giving clients control over their healing journey. When it comes to gender trauma, extra attention must be paid to language, recognition of minority stress, and never pressuring clients to explain or defend their identity. There are several therapeutic approaches that can be particularly effective. Cognitive behavioral therapy, CBT, when adapted for gender focus, can help challenge internalized stigma and negative beliefs about oneself. Narrative therapy allows clients to rewrite their stories, emphasizing resilience and identity validation. Somatic therapy recognizes that trauma is stored in the body, using techniques like breathing exercises and grounding to heal physical manifestations of stress. Group therapy and peer support can provide a sense of belonging and reduce isolation, validating one's experiences through shared stories. Creating safe and inclusive spaces is paramount in gender trauma-informed therapy. This starts with language, using correct pronouns and affirming terminology signals respect and safety. Cultural competence means understanding diverse gender experiences across different backgrounds. Building trust is essential, especially for trauma survivors who may have lost faith in institutions. Therapists must consistently affirm identities, honor confidentiality, and validate experiences. It's equally important to avoid re-traumatization by steering clear of forced disclosure, questioning identity, or making assumptions. Real-world examples can illustrate the power of this approach. Consider someone who moves from isolation and shame to resilience and self-acceptance through consistent therapy. Or look at community-led initiatives like LGBTQ+ centers and grassroots projects providing accessible, affirming care. These stories add hope and credibility to the healing process. However, challenges and barriers still exist. Gender trauma remains stigmatized in many societies, preventing people from seeking help. In rural or conservative areas, affirming therapists may be scarce. Financial constraints and systemic barriers also play a role, as therapy can be expensive and insurance often doesn't cover specialized care. This gap between need and accessibility is a critical issue that needs addressing. Looking to the future, there's hope on the horizon. Digital therapy and telehealth are expanding access, especially for those in underserved areas. Universities and research centers are increasingly studying gender trauma, meaning future therapists will be better prepared to help. Advocacy is pushing for policy changes, including health insurance coverage, anti-discrimination laws, and better inclusion of trauma-informed care in public health systems. In conclusion, gender trauma-informed therapy is essential for mental health, resilience, and empowerment. It provides a path to healing that honors identity, ensures safety, and supports recovery. By understanding and addressing the unique challenges faced by those dealing with gender-based trauma, we can create a more inclusive and supportive mental health landscape. We'd love to hear from you. Have you had experiences with gender trauma-informed therapy? Do you have questions about the approaches we've discussed? Share your thoughts in the comments below. Your voice matters, and your story could inspire others on their healing journey. Remember, by subscribing to our channel, you'll get more in-depth videos on mental health, psychology, and healing. We're here as a resource and support system, providing insights and information to help you on your path to a healthier mind. Together, we can build a community of understanding and growth. So hit that subscribe button, and let's continue this important conversation. Your journey to healing and self-discovery starts here, and we're honored to be a part of it.